With 21 years of cosmetic dentistry experience, Dr. Corey is bringing some very remarkable services to his clients, and we want to talk about more of these things, this one is what? This is an interesting technology, I think, as well.
Right. It's an X-ray, but it's not a normal two-dimensional X-ray. Like most patients that go to dentists, they realize they get bite wings once a year, or a panorex that goes around your head. This one here, we call it a cone beam. It's more or less like a CT. Everybody knows what an MRI or a CT is. You have to go to a hospital or an imaging center. We can do that in office, much less expensive and much less radiation exposure.
So what is that as a doctor then, or as a dentist, what is the advantage of that? What does it let you see that you couldn't see otherwise?
It lets us see just about everything from what we call the frontal sinus, all the way down to about the cervical spine. So any situation that, we find a lot of times with sinuses, and we refer to ENTs, but obviously that's not why we take them.
Right.
We're taking them for a dental reason, but we can see just about fractured roots, infections. And one of the main reasons we have it is if you have a missing tooth or if you need an implant. It's a real nice way to do that because we use what's called guided implants, where it's a non-surgical procedure. And if anyone out there has ever had an implant, they realize that the traditional way is it's a surgical procedure where you have to make incisions and then go in and put the implant in and then suture it up, and then you're on a narcotic for a week. The way we do it, it's patient comes in, we already did all the pre-planning digitally. And so there's no surgery, we just put the implant in, there's no sutures, patient gets up and goes right back to work that same day, no narcotics.
That's remarkable. I mean, that is a significant difference in in everything, my loss of work, the way I feel. I don't want to take narcotics because you know what they can lead to. I mean, that's just, a whole lot of advancement, it seems like, all in one fell swoop.
And it's what we call a guided implant. The other way to do it, if you don't have this technology, is kind of freehand it. So beyond the surgery, it's placing an implant. If you can imagine, if you had a space and you're going to place an implant, if you're just going to freehand that, it might go into a workable space.
Right.
You know, sometimes it may not be in the ideal position, but if you do it in a guided way, where you snap something on the patient's teeth and it goes exactly where you planned it on this X-ray, it's perfectly placed, it's non-traumatic, and everything goes well. There's no mishaps.
Yeah, I'm thinking about every home improvement project I've ever tried where I try to wing it and it doesn't really work so well. But this obviously works really well because you've already done it in virtual reality and then in real space, and then all of a sudden it just goes right in.
Correct. And then, we see quite a bit of patients come in, new patients that are frustrated because they've had pain or discomfort with a tooth that either was previously worked on or just has been bothering them, and they can't get a diagnosis on why. And it's not the fault of the dentist that they're going to. It's they don't have the technology to really see what's going on. So, if we have a patient who comes in and they've had a problem, could be they've been enduring this problem for years. And it's just frustrating them. And we put them into the cone beam, and within 5 minutes, we know exactly what's going on.
That is remarkable.
Yeah.
And will most people experience one of these bigger dental procedures in their lifetime, or?
Usually. Today we dentistry with preventative of fluoride and everything. We don't have as many missing teeth or many patients with dentures. But there will be a reason to have a cone beam at some point in your life.
Well, it's good to know that technology is there, because again, that's a whole different thing. If you want to find out more about Dr. Corey and the work he's doing with this technology up on the northwest side of Fort Wayne, you can learn more on their webpage, taking patients from around the area, and you can learn more there, or give them a call at 489-0078. We'll be right back on Insight.